I believe you are well. I welcome you back to my YouTube channel. This is JEMIENAFTALY and the channel's name is The Pediatric World. It's only here, it's only in this platform whereby we discuss, we create the awareness. We want to discuss with the mothers, with the caregivers, with guardians and with everybody on the common illnesses affecting children while growing up. Here we try to talk in a language that everybody is able to understand. That's why we want to be so much layman here, so that everybody is able to understand. So here we create the awareness on the common illnesses affecting children while growing up. So feel at home, and if you haven't subscribed, please do. If you are new, please join the family. So welcome to this episode, and in today's episode we are going to continue on convulsions in children. Remember, we started on convulsions in children on the other previous episode. So today we are going to see the approach in management of convulsing children. What approach do we use while treating these babies, these children that come with convulsions? So the approach, what we should do, number one, is something we call ABCD. So A stands for the airway, B stands for breathing, C for circulation, D is for disability. So just a note to note that this is for you, my fellow professional caregivers. It is noted that most health workers rush to giving anticonvulsants. Anticonvulsants are drugs that are used in convulsing children. So they rush into giving anticonvulsants due to the anxiety. Of course, there's an anxiety caused by the convulsing children. So less attention then is paid to this ABCD. And this eventually it leads to brain damage and death. Hence then, what are we saying? We are saying that the approach begins with ABCD. When treating a convulsing child, we should start with ensuring that the airway is patent, the breathing, B for breathing, C for circulation, and D for disability. So please remember that we don't rush into giving those drugs for the anticonvulsants. So we start with ABCD. So now, without further ado, let's move to A, the airway. We said A stands for airway. The airway is at risk of getting compromised in convulsing child. So what do we do to ensure that it is patent, the airway is patent? So we place the child in a flat surface. It is a flat surface, and in a recovery position. A recovery position, why? This helps in maintaining the airway patent by preventing the secretions that may cause obstruction. So the recovery position is we lay the baby sideways, so that if there are any secretions can easily come out, than making the child lie upward or the other way. So what we do, the recovery position is this: the baby is lying on their side, so that if there are any secretions can come out very, very easily without causing obstruction. Imagine the baby is lying looking up, so the secretions are going to block going to the airway, and this will cause obstruction. So the sideway is what we are calling the recovery position. Hope you understand. Hope you have understood what you have said. So this is how the child should be placed. And again, to take care of the airway, we should sanction. We sanction to clear any secretions, and we sanction up to where we can see. We remove those. Sanctioning is removing those secretions either from the noses or from the mouth. So this is another way again of taking care of the airways. And from here, if the airway is clear by positioning the child the way they're supposed to be positioned, the recovery position, what you have said, and also there are no secretions, we have cleared the secretions by sanctioning. Now we can say the airway is taken care of, and now we move to B. B is for breathing. We start taking care of breathing, and we ensure that there is adequate breathing. And this may lead us to giving oxygen. So when we are giving oxygen, we are supporting breathing. So if the child there's something we call SpO2, the oxygen saturations, they should be at least, we mentioned somewhere, they should be at least 90%, 90 and above. So if we are below this, and mostly for these convulsing children, they are going to have low SpO2. So that is the low oxygen saturations. So that's why we want to support them by giving oxygen. This way we are taking care of breathing. Now, after breathing, and this oxygen we say we give especially if the child convulses for more than 5 minutes. So this is serious because as the child convulses, there is some brain damage, like we said. There is some brain damage that occurs. So that is why we want to give. If there is the child convulses for more than 5 minutes, we want to give oxygen to support them. So after now the breathing is clear, we can now go on to doing move to management of circulation. So just before we move to circulation, ensure the first thing we said it is airway. Another way is by breathing, and we have said that before giving any anticonvulsants, healthcare workers, please ensure that ABCD is taken care of. And from here now, we are going to move in our next episode. We don't want to move fast, we want to go slowly. So we have managed the ABCD. We have said the approach is ABCD in summary. And we have said what to do in A, that is in airway, and also in B, the breathing. So in our next episode, we shall check on circulation, how to take care of the circulation, and now the disability, just before rushing to giving the anticonvulsants, those drugs used in preventing these convulsions. So thank you again for staying tuned. Stay with me. If you haven't watched the previous episode where we started on convulsions in children, please do so that you're not lost and so that we may move together. So thank you, my people, for listening to me and for staying tuned. If you haven't subscribed, kindly hit on the subscribe button. Subscribe if you're watching and you haven't subscribed. And also leave a comment below on the comment section. Share these videos again widely. Remember, we are saying the main aim here, we want to have the end result. We want to have healthy babies. We also want to improve their quality of life. So kindly share these videos widely. We want to ensure that mothers are part of this management. We want you to be part of management of these babies. So thank you so much. Till next time. Bye.